Different medications have different side effects. And in today's video, we shall talk about the common side effects faced by our clients who receive services for mental health from us. And the common side effects they face include the following. Number one, sedation, which can be oversleeping or drowsiness caused as an effect of using drugs, for example, chlorpromazine or Haldol. Number two, a dry mouth. Number three, dizziness when standing up. Sometimes these antipsychotics, when given, patients always tend to get postural hypertension as an effect of antipsychotics. Therefore, patients always experience dizziness on standing up. Next, weight gain is always observed in some patients, especially when drugs like olanzapine and risperidone are used. Sleep changes. Sometimes patients get too much sleep after taking the drugs. Then others tend to lack sleep due to effects of drugs causing restlessness in those patients. Number six, akathisia. So akathisia is a broad term, meaning it's a movement disorder characterized by inner restlessness and a compelling urge to move. And in this case, a patient might be seen unable to stand still. For example, standing while moving the legs. Sometimes they are unable to sit and concentrate in one place for some minutes. This is because the muscles are trying to stretch. Sometimes people are unable to control the movements of their muscles, especially the fingers. You might find when the fingers are shaking, like the way you see my fingers, but it happens involuntarily. They have no control over it. And sometimes they have a compelling urge to move. For example, they feel like their legs are telling them to move from place to place. Number seven, tardive dyskinesia. Tardive dyskinesia. Katugambe, a movement disorder characterized by involuntary or repetitive movements of the face, neck, and the limbs. This is a common side effect observed in people getting antipsychotic medications. And it's always witnessed sometimes by the following signs. Number one, rigidity of the neck. Number two, eyes can look upwards, unable to come back. Three, the tongue can protrude outside. Four, sometimes they start to get rapid blinking of the eyes. Five, lip smacking. Sometimes patients can be observed licking their lips every time, but involuntarily when it's not them doing it willingly. And lastly, sometimes patients tend to get a robot-like movement, a robot stature when moving. That is really a side effect of antipsychotics. And number 8, some people tend to get neuroleptic malignant syndrome, but that is an adverse side effect which is not commonly seen in antipsychotics. However, get to know that each side effect for the antipsychotics talked about has a solution, and the solutions are only met when a patient meets the attending physician or the attending health worker to give a solution, and mostly we give Aten to calm down the side effects. So watch our next video to find out the common ways on how we can manage the side effects. First, by patients taking antipsychotic medication for their health. Thank you and see you in our next video.